think dyslipidemia has no symptoms, that's only the half the truth. While 90% of the patient are silent, 10% show very specific signs on their body. If you're PharmD, MBBS or NAPLEX students, missing these signs means losing your marks. So hi, I'm SHIFANA in Zen with SHIFANA. Today, based on Dipiro Pharmacotherapy, we'll cover the complete clinical presentation of dyslipidemia. Let's start. So, the first 90% of the patients with dyslipidemia are asymptomatic. Most patients will say, Doctor, I feel completely normal. That's the problem. Dyslipidemia is a silent disease. The most common presentation is no symptoms at all. It's only detected by a routine lipid panel, as you can see here. We get elevated total cholesterol, elevated LDL, elevated triglyceride, and all. So here's a key Dipiro point. Screening is critical after the age of 20. Even if you are asymptomatic, you need a baseline lipid profile because if you don't detect it earlier, it silently leads to atherosclerosis, myocardial infarction, and stroke. Now let's talk about the 10% who have visible signs. First is xanthomas. These are yellowish lipid deposits in the skin or tendons. The most common type is tendons xanthomas, seen on the extensor tendons of the hands, knuckles, and the Achilles tendon. According to Dipiro, tendon xanthomas are the pathognomonic of the familial hypercholesterolemia. So, pathognomonic is means if you see it, the diagnosis is almost certain. This usually occurs when the LDL level is greater than 300 milligrams per deciliter, which is very high. Next comes the Xanthelasma Palpebrarum. These are soft yellowish plaque found on the eyelids, especially near the inner corner of the eye. So here's the important clinical note. Xanthelasma can occur even in patients with normal lipid levels. So it's the presence is not diagnostic, but it still warrants a lipid profile to rule out the elevated LDL. Next comes the corneal arcus, also called as arcus senilis. This is a grayish white ring or arc seen at the periphery of the cornea. Here is your Dipiro exam tip. If it's present in patient older than 50 years, it's called Arcus senilis and it's considered normal aging. If you see a corneal arcus in someone younger than 50 years, that is abnormal. It is a strong indicator of the familial hypercholesterolemia. So age is the differentiating factor over here. Remember, over 50 is normal, under 50 is a red flag. Then comes the eruptive xanthomas. Unlike tendon xanthomas, these are small yellowish red papules with an erythematous base. They typically appear on the back, buttocks, shoulder, and thighs. This is a critical Dipiro red flag. Eruptive xanthomas indicate severely elevated triglyceride levels, usually greater than 1000 milligrams per deciliter. And when triglycerides are above 1000, the patient is at a high risk of acute pancreatitis. If you see eruptive xanthomas checking triglycerides becomes an emergency, it's not just a cosmetic issue. Finally, let's look at the lipid panel and complications. In dyslipidemia, we typically see total cholesterol greater than 200, LDL cholesterol greater than 130, triglyceride greater than 150, and HDL cholesterol is less than 40. Remember, HDL is the good cholesterol. If left untreated, the long term complications are severe. High LDL leads to coronary artery disease and myocardial infarction. It can cause stroke in the brain. And as we just discussed, very high triglyceride can lead to pancreatitis. So, a quick recap for your exams. First, 90% are asymptomatic, screen after the age of 20. Second will be Tendon Xanthomas means a familial hypercholesterolemia if LDL is over 300. Third will be Corneal Arcus under 50 is a danger sign. And fourth will be your Eruptive Xanthomas means triglycerides over 1000 and risk of pancreatitis. And five, silent does not mean safe. Save this video for your GPAT, NAPLEX or MBBS Viva. Comment below which of these signs was new to you. Next step will be your dyslipidemia diagnosis. Subscribe to Zen with Shifana for more Dipiro based notes. Thank you guys.